Hi, everybody. I want to welcome you to the Resident and Family Support Council meeting that we host on the second and the fourth Tuesday of every month at 3 o'clock. And always remember that the link that brought you into this meeting, you can use for every single meeting. So you can make it a favorite for yourself so that you can get it nice and easily. Also, share it with any of your friends, families, neighbors, because the information that we share during these meetings can be really empowering information to help everybody understand and help navigate that long-term care system, which can be really overwhelming for people. My name is Lee Moriarty, and I'm the Deputy State Long-Term Care Ombudsman, and we host these meetings in conjunction with the Illinois Pioneer Coalition, who's really great about letting us use their website, their Zoom account, to be able to host these meetings. So we're very grateful to the Illinois Pioneer Coalition for allowing us to do that. If you have any questions, please feel free to go ahead and either unmute your microphone, raise your hand. You can find that at the bottom. There should be a button or at the top of your screen that says reactions. And if you click on that, there's a place there that you can put hand gestures up. Also, if you unmute yourself, many times I can see that you've unmuted, or one of the other people helping me out can go ahead and let me know that there's somebody who'd like to ask a question. Or you can also always type it into the chat if you don't want to speak up. That's perfectly fine as well. Today's topic, we're actually going to be talking about the different types of long-term care communities that exist in Illinois, and there are quite a few. I'm going to be doing today's presentation, so what I am actually going to do is share my screen right now so that I can get to the presentation. Okay. Okay. So like I said, today we're going to be talking about all the different types of long-term care communities in Illinois. So one of the things that we have is we have a resource tool that I'm going to be sharing with you. And we've already been able to get this posted onto our website. And what's on this resource tool is the different types of homes that exist, the federal law and the federal regulation, the state law, the state regulation, and then the agency that actually regulates that entity, and the advocacy agency that helps advocate for the people who live in that entity. Just a little bit about the law and regulation, just so that we can understand. The law is actually what takes place to be able to enact how a regulation will play out. The regulation always entails much more detailed information, typically entails much more detailed information on how that law would play out. A law actually needs to go through the governmental entities to be able to be passed into law. And then the regulation is the product of that law. We're giving you the links to both of these so that you can understand how this plays out and where those things are located. So what I'm going to do is actually, to start off this conversation, is I am going to click on the tool, which was right at the bottom of the screen. And I'm hoping that we can get that put into the chat so that you guys can all see that meeting. And also we'll be getting these website postings also on with this meeting materials today. So you see when I clicked on that link where it brought me to the page for the Long-Term Care Ombudsman Program that is—
Hey, Lee.
Yeah.
We can only see the slideshow. We can't see your web browser.
Okay, because I need to stop my share and I need to share my screen. So thank you for that, Stephen.
You're welcome. That's what I'm here for.
Yep, thank you. You keep me in line. Okay, so let me go to share again. Okay, now let me know if you can see it.
I can see it.
Perfect, thank you. So like I said, what you'll see on the screen here is actually, this is the website for the Resident Family Support Council. It's connected to the Department on Aging's website. As you can see here, this is the Department on Aging's website, and these are all the different programs and how to contact for the Department on Aging. In a couple of weeks, actually, let me get the date for everybody. On June 11th, we're actually going to be having somebody from the Department on Aging go through and talk to us more exactly about what the Department on Aging does and all the different services that are available out there for people through the Department on Aging. So that should be a really great meeting. But to bring us back to this page, this is for the Resident and Family Support Council page. And on this page, if you have not taken a look at this yet, let me share with you some information that's on here. What you'll see is the meetings. So here it is, the description for today's meeting, you can see is right here. And then here's the description for our next meeting on May 28th, which is for the Montessori method in dementia care. And then also below that are all the different meetings that we've ever had. And you can see that there are presentation materials that are affiliated with many of these. And this is if we had the PowerPoint or other resource information shared with us, they get posted onto this page as well. So this is a great place to be able to go, to be able to see what it is that we've talked about, because then you can also go to the YouTube page, which if you click on this blue area right here, that will bring you right to the YouTube page, which will bring you to the recording of all of these meetings. So that's a really great resource for everybody. And then lastly, if you do not know how to get into this meeting and you forget, you can always just Google Illinois Long-Term Care Ombudsman Program. It will take you to the Ombudsman page, and then you can click on the link for the Resident and Family Support Council, which will bring you to this page. And you could just click here, right under the meetings, and this will bring you, so it's bringing me to the meeting. I don't want to do that. It'll bring you right to the meeting. So let me now, I gotta move this screen so I can get back to the page that we're talking about. So right here, you can see this is the sheet right here that I'm gonna be using today to lead our conversation. I just clicked on the link and hopefully it comes up. And now can you guys all see that? Is that a good thumbs up?
Yep, we can see it.
Thank you. So this is actually the resource tool that is on the website and that I'm going to be using to help guide us in our conversation today. I'm not going to be clicking on all of these various links because we'll be here forever and I will bore you to death. But what I want to bring out some points about this site. So what it has is, like I said, it has a federal law on it. And if you click on the blue, I will do here, I'm going to click on this one. There's actually two links for this because one is easier to navigate than the other. You'll see here that this brings you to the code for nursing homes. And this is the law for nursing homes. So I'm going to stop that one. And one of the things that I wanted to share with everybody was something that can really be helpful. If we go to the regulation, and I'm going to click now on the federal regulation. So one of the things that you'll see here, this brought me to where I was last, is this is the federal regulation here. And you should check to see the revision date on it because this was just revised on 2/3/23. So that's important to take a look at to see. And what you want to do, one of the things that I wanted to share with everybody is if you click on these little dots way over here, or you do a Control F, which people might know how to do it that way as well, and you go down to this Find on Page, you can click on that. And let's say you've got a question about, let's say you've got a question about mail, and you're curious if there's anything to do with mail in the regulation. Well, you go ahead and you could type mail into the box at that top. And then all the times that mail is mentioned in the federal regulations, you can see it's mentioned 35 times in the federal regulation. And what that does is it brings you to every time that that word is mentioned, it brings you to the regulation regarding that. So the very first one that it's showing is that that the resident has the right to access personal medical records pertaining to him or herself. And one of the things that they have to, the facility must allow the resident to obtain a copy of the records or any portions thereof upon request and 2 working days advance notice to the facility. Facility may impose a reasonable cost-based fee on the provision of the copies, provided that the fee includes only the following, and that would be the labor, for copying those papers, the supplies for creating the paper copy, and the postage that will be mailed. And then you see where that term mailed comes up. So this could be a helpful way, like if you had concerns maybe about skin issues or falls or visitation, you could type those words in and you can see when it comes up, and then you can access that regulation right there. Does anybody have any questions about that?
I do.
Yeah, go
It's
ahead.
very
Ask.
good. Um, if what can you do if your facility isn't actually providing the requested? I mean, I was in the facility 2 years. About 6 months in, I asked for my a copy of all my medical records, anything in writing that had ever been done, because I was being told things were in my care plan. I hadn't even seen a care plan. Regardless,
Mhm.
I got them almost a year and 3 months later. I reported it to the ombudsman. I reported it to IDPH, and for some reason, it was never addressed. It was just like it didn't matter. It was very, very frustrating. I've also had people in my group tell me about it taking long times as well, but also that they were being charged $600 for their medical records.
That can get very exorbitant, right? Who can afford $600 to get their medical records?
Well, and what is it about an electronic or a paper copy that costs $600? Let's just face it, printing out from your computer program does not cost that, and it doesn't have many thousands of pages to it. So that makes no sense at all if it's just the cost of doing it.
Yeah,
So
and
I'm just wondering how you address that stuff.
so one of the things that I would actually recommend, and that's why we wanted to share the regulations with everybody, is I would actually take this and run a big old copy of it. And I would then next to it where it says what they could cost. First of all, that, hey, I'm allowed to have these within 24 hours, excluding weekends and holidays. This is the regulation. I'd put that there. And then I would put the labor, and I'd estimate maybe somebody being paid, you know, let's say it would take maybe 2 hours. And so you could say $100 tops. Supplies for creating the paper. How much does paper cost? How much does a copy cost? 3 cents. So if my record, for 3 cents, and then the postage, how much postage is. But part of this is, do you really need the whole record? Or do you just want the copy of the care plan, or the copy of your social services notes, or your rehab notes, because if you get a copy of your whole record, you could very well be getting 600 pages worth of stuff. So ask yourself that as well. But I would also then make sure that when I do write the complaint to IDPH, to Illinois Department of Public Health, I would say, as it states in F573, that's the reference code number, as it states in that, I have the right to my records. And I would make that part of the complaint, lead them to what it is that you're talking about. Sometimes the more information we can put in there, the better it can be for IDPH. I don't know if anyone else has any other suggestions for Mary as well. Okay.
Well,
I know,
yeah,
Mary, that can be a very frustrating thing. Stephen, did you have something to share?
yeah. The great thing about the State Operations Manual Appendix PP is that not only does it show you the federal reg, but it gives you a lot of information on what public health is looking for. And so as you're going through and showing them, hey, here's the reg that I'm concerned that they have violated, you can point right to their guidance and say, it's on page, whatever. I can't see your page number, so I can't throw out an example. It's on page 38, and here we go. You can highlight issues that you have right with the guidance.
Well,
And-
and when I actually turned in my written request, because I had requested several months in a row for speaking it to them, But once I finally submitted the written request, I actually gave them a copy of the residents' rights that's done by the Ombudsman program. And I highlighted that part that says that I was supposed to have supposed to be given to me within whatever the time frame is in that document, and didn't make any difference.
All we can do is try to hold people to the letter of the law. And I mean, I know, Mary, that you've experienced, and I know that this was a big issue with you in trying to get a copy of those medical records, and that can be very, very frustrating. And all I can say is that, we just got to keep fighting that fight. We can't, as ombudsman, we can't make people do things. We do not have that power. All we can do is continue to point things out to people and make sure that they are understanding that there is a regulation, the person has the right to this, and a complaint will be filed if the resident chooses to do so, if you are not abiding by those regulations. I wish there was this magic wand that we could all wave and say, now you're in trouble. You didn't do it, now you're in trouble. But unfortunately, that does not exist. So all we can do is try to be as educated as we can, which is the purpose of us wanting to share this tool with everybody, so that we're not the only ones as ombudsmen that are empowered with this information, that everybody can have access to this information at any time. And we tried to do it in a method by sharing that, by doing it in this tool, that we, I'm bringing us back to that tool. So to make it all in one spot so that everybody could very easily be able to navigate this on your own. That was our purpose for this, is trying to make sure that we're providing those resources and information. So I wish there was something more magical or concrete that I could tell you regarding that, but I know it stinks. It really does. And it's unfortunate, but we try, and we can't stop trying, because the more we talk about the stuff, the more people will be able to understand that they have to be held to standards. So this is just to let you kind of see through the course of the sheet, like I said, the federal law, the federal regulation, the state law, the state regulation, and then the regulatory agency that actually oversees that entity. And for this case, it's Department of Public Health, and then the advocacy agency. And again, for this case, that is the Illinois Long-Term Care Ombudsman Program, of which Stephen and I are a part of. And you'll notice at the beginning of this is these are all here: skilled, intermediate care for developmentally disabled, state-operated developmental centers, and Illinois veterans homes. We're going to be talking about each of these individually and explain them a little bit more, but these are all have federal regulations affiliated with them. Now, if you notice on page 2 of this document that you'll be able to access, the following are not regulated by the federal government. And these are those entities that are not regulated by the federal government, only the state. So I wanted to make sure that everybody was aware of that. So with that, then what I'm going to do now is I'm going to go back, and hopefully I can do this seamlessly and bring us to back to the presentation. And do you guys see that up on the tool, on the thing? Do you see resource tool, the PowerPoint? Okay, great. Thank you. So
Hey,
the
Lee,
other thing
it's
that I do
Karen.
go ahead.
And I'm sorry to interrupt the flow, but I
Mhm.
just wanted to let Mary know that I put some links in the chat relating to information about record requests and rights under the Health Insurance Portability and Accountability Act that she may want to take a look at. And then when you were clicking, I just wanted to point out, you clicked into the manual and not the federal regulation itself. There's 2 separate listings, and obviously the manual mirrors the federal regulation.
Yes. Thank you, Karen, for that. Yes, and that manual is the tool that most of us go to, because like Stephen said, it has the guidance in there as well for how the surveyors should be reviewing that material. Thank you, Karen. Thank you.
Thank you, Karen. I appreciate it. I was actually just looking through those links when you spoke up, so I appreciate it.
Thank you, Karen. So the other thing that I wanted to point out is you're going to see this big O with Buddy name tag on there. And this is the new mascot, if you want to call it, for the long-term care, for the Illinois Long-Term Care Ombudsman Program. If you see Buddy on any materials, know that these are advocacy materials that are for those who live or those who love someone or do some advocacy work for those that live in long-term care. So we're going to be stay tuned. At the end of this presentation, we're going to be asking all of you for your opinions about something. So I do want to make sure that everybody stay tuned for the end of this, where we're going to be asking you for some advice on where to go with this. So stay tuned for that. So the first thing then that first entity that I wanted to talk about was the skilled nursing facilities. You may refer to skilled nursing care facilities. You may have heard of rehab facilities. A rehab facility and a skilled nursing care facility is the same thing. We want to make sure that everybody is aware of that. There really is nothing called a rehab facility in any of the state or federal laws. They would be referred to as a skilled nursing facility for Illinois. And what does that mean? What type of care gets provided at a skilled nursing facility? Here, they provide nursing and therapy services that are provided only by licensed skilled professionals. And that would be such as a nurse or like a physical therapist, an occupational therapist, a speech therapist. Many times when your friends or yourself have gone into a nursing home for rehabilitation, maybe under Medicare, that would have been a skilled nursing facility. Medicare is typically the payer source for those who enter into skilled nursing, and they have up to that 100 days of skilled care that can be provided for through Medicare. But also know that 100 days is very rare to see. It typically does not last around 100 days. From my own experience, I could say it's probably more between 1 and 3 weeks. Tops that you ever see. So that's nowhere near 100 days. I think people feel like, oh, yay, I'm going to get 100 days there. I'll be able to rehab very, very well. And then I'll be back in another, in 100 days back to my home. But it typically doesn't, we do not have 100 days of Medicare that gets used. So that's just important for people to know right from the beginning. Other skilled care that could be provided, like I said, physical therapy, it might be wound care, speech therapy, IV medications, and things like that. And like I said, this is typically that home that is referred to as a rehab facility for those people that might be leaving the hospital and then going on for further rehab care. Please stop if you have any questions about this along the way. The next entity that I wanted to talk about is an immediate care facility. Immediate care facility would be what we would really refer to more or less as that nursing home, that long-term care community that really provides that custodial care for individuals that may need assistance with some of their activities of daily living. The federal government actually refers to intermediate care facilities in their regulations as nursing homes. So beware that that's how they refer to them. So those ADL, those activities of daily living, the ADL activities would be, you might need assistance with either eating and or dressing and or walking or any other of your personal needs, bathing, things along those lines. Medicaid may pay for some people that are in intermediate care, but Medicare never pays for intermediate care. Also, people will potentially pay for this privately as well. So people may be in an intermediate care facility paying for it in a private manner. They're paying for it from their own funding sources. And the goal of an intermediate care facility is really to provide that safe, comfortable, and caring environments for people who are unable to live independently. So that's really the criteria there for that intermediate care facility. The next entity.
Hey,
Go
Lee,
ahead.
could I,
Mhm.
before you move on, I just want to point out to people that most of the time, a nursing home is comprised of both skilled nursing and intermediate care. So you'll see people go into skilled care for rehab, and then some of them will stay as an intermediate care resident. So just something
Thank
to
you
point
for-
out.
Yep, absolutely. Thank you for that, because that's an important point. And many times you'll see like the rehab facility, the rehab, the skilled license will be on the first floor, and then they'll have the intermediate care up on some of the other floors if it's a multi-floor building. Also to know that intermediate care facilities, I will back that up just so people don't get confused. Intermediate care facilities may sometimes have a dementia neighborhood on it. So know that that's something that could exist as well in that intermediate care environment. There may be a specialty of dementia on one of those floors, one of those units, one of those neighborhoods as well. So intermediate care facilities for the developmentally disabled. That is basically similar to an intermediate care facility, but these are for people who have a developmental disability. These are referred to also as IDDs. And people who live in these homes are typically mobile adults, and they need physical, intellectual, social, and emotional assistance. Many times you'll find that the people who live here are out of the building throughout the course of the day because they go to something that we refer to as a workshop. So that's their work opportunity. They may be paid small stipends for doing that work. But then that's what helps add structure to the day and helps provide them with an income source to be able to do what it is that they want to do with those funds. And what is required when people go out to a workshop is that the staff that work in that facility and the staff that work in that workshop need to work together on common goals so that it's very coordinated care for the individuals who live there. People who live there may be receiving Social Security or Medicaid benefits that might also help pay for their room and their board. The next entity is state-operated developmental centers. And on here, you'll see that there is a link. Before I click on that link, I will let you, let me just explain what these are. So a state-operated developmental facility really provides intensive care that can't be provided for in a home or in a community-based residential program for people that have a developmental disability. The Department of Human Services are the ones who operate these. And there are actually 7 of these in the state and they really provide care for mental health as well as developmental disability. And the emphasis on these is really for assisting people to achieve their own personal goals of living where and with whom they choose, coupled with working on getting those community resources to help sustain that. So that link that I'm clicking on from here, and I want to make sure that you guys can all see this. I believe that that's going to get put into the chat as well. These are where the state-operated developmental centers are located throughout the state. As you can see, there's 7. There's actually 6 on the screen, with the one more down at the bottom, Shapiro, which I just brought up. So they are located in Anna, Illinois, in Park Forest, Illinois, in Dwight, in Dixon, in Waukegan, Centralia, and Kankakee is where these are located. The reason why I wanted to bring you to this site is because I do know that we have people that attend this meeting that have asked us questions about developmental care centers previously. So talking about the entity previously and then the state-operated ones now, we're going to be talking about a couple of more. I wanted to make sure that you were aware of the resources out there provided by the state. And then if you click on the link that's over here in the corner,
Hey, Lee,
that actually, yes,
we can't see your browser. We
you're
can
not
only
seeing that.
no,
it's
we can
actually-
only see your slideshow.
Okay, so I thought it was, if I was sharing my screen, it would let me. So let me bring that back because I do want to make sure that people can see this. I thought Zoom had changed. I know you could do it with WebEx, but Zoom, I guess it doesn't do that still. So let me go here and click on this. Hopefully this will work. Now I just want to back it up. Are you seeing it now?
Yes.
Okay, so this is the website link that's being put into your chat about the state-operated developmental centers. And then, like I was saying, there is a link over here for the state-operated developmental centers and their profiles. So if you click on that, what it will do is then you can click on each of these individually, and then you can get an idea of their census, their age, the populations that they are serving, if they've got a behavior intervention program, and then also their psychotropic medications that people are receiving in there. So this can help give you a little bit of information if you are looking for an entity as such for you or your loved one. So I will go back and stop my share there and bring back up. Okay. Okay, so I'm going to move from there then. I'm going to now move on to the next entity to talk about, which is the Illinois Veterans Home. And come on. Okay, Illinois Veterans Homes. The Illinois Department of Veterans Affairs has 5 veterans homes in the state of Illinois. They are in Anna, LaSalle, Manteno, Quincy, and the newly opened one is in Chicago. These are licensed by the Department of Public Health, and then they're certified by the Department of Veterans Affairs Medical Center. The mission to veterans homes is based upon military service, as well as medical need, and very important, availability. We have one of the administrators for the Illinois Veterans Homes for the state of Illinois will be joining us in a couple of weeks. We are looking at the date for that one, and she's going to be sharing more with us about the veterans homes then. And I don't know if we have an exact date on that, but stay tuned for that, because that will be coming up in the very near future. There is a lot of very valuable information to know, even if you're a veteran and you don't live in a veterans home. I want to make sure that those of you who know somebody that's aging in Illinois that is a veteran, or their spouse, it's important to know that as well, that they attend that meeting, because they may really wound up learning some really great resources that can help them as they're aging as well. And on here is the link, which if that could go ahead and be put, I won't put that into I won't click on it right now, but this link brings you to the locations of those homes so that you could then get a better feel for what those homes are about as well. And I believe that's getting put into the chat as we speak. Okay, so the next thing to talk about are life care facilities. These are also known as continuing care retirement communities, CCRCs. You might have heard them referred to as that. So life care facilities actually is an umbrella that within it, it has independent living, assisted living, and typically skilled care as well. So they have all 3 entities inside of them. The idea being that that one campus, once you buy in to that campus, you can live there for the rest of your life, from being independent all the way till needing skilled care. And they are typically private pay entities, and they vary in cost. So they can be very drastic in the cost, and as well as the amenities that you get. And so there really are, there are some state regulations around this. There's no federal regulations around life care facilities. And so what you should be looking at if you live in a life care facility is the entity that you actually live in. So if you live in the skilled portion, those would be the regulations that you would be that they need to be following. Assisted living and shared housing establishments, we typically just refer to them as assisted livings here in Illinois. And those are community-based residential homes that provide care for residents who don't need that 24-hour-a-day services of a nurse. They may need some help with activities of daily living, the people who live there, maybe like meal preparation or getting dressed. But it's not for a person to live there that has those skilled requirements that would make them go into live into a nursing home, the intermediate care facilities that we referenced earlier. The support you may see might be personal support, any intermittent health related services, and it should be available 24 hours a day, but the ratio of staff to the people who live there is going to be much, much, much smaller than it would be if you lived in a nursing home. So with that being said, people need to understand that when you move into an assisted living, it might have 24-hour care there, but the numbers of staff are not going to be the same. So the needs cannot be addressed as readily and as quickly as they could for somebody who lives in a skilled or a intermediate care nursing home. Assisted livings are private pay entities, and they're not certified to accept either Medicare or Medicaid. But that's for Illinois. It can be different in other states. So because in Illinois, assisted livings do not accept Medicaid or Medicare, we have something that's referred to as a supportive living, which is the next thing that I wanted to talk about. Supportive living is an Illinois specific thing, and it's that alternative for assisted living for low income older adults that have either physical disabilities that are receiving Medicaid. These are overseen by the Department of Healthcare and Family Services, and you obtain a waiver to allow for those services to be covered by Medicaid. They're very, very similar in appearance to an assisted living establishment. They can look very, very similar in terms of the care that is provided. The resident is responsible for paying the room and the board at the facility. And a supportive living must designate what type of population they're going to serve, because there are some supportive livings that serve those between 22 and 64 with a physical disability. And then there's other ones that only service people that are age 65 or older. So you want to make sure that when you're looking at these, that you're looking at the ones that can support your age bracket that you live in.
And something that's really important to know about supportive living, you can go in as a private pay individual, and then if you run out of money, you can continue to stay there under that waiver. But when you go under the waiver, you're going to be limited to currently your personal needs allowance, as it's called in the nursing homes, is $90 a month. And so you would be able to keep $90 a month, and the rest of your income goes to the facility to pay for your stay, and Medicaid picks up the rest of the bill.
Thank you, Stephen. And this is, I actually think that this is a great thing that Illinois does this for those people that have limited funds, so they can be able to live in a supportive environment that they may need. Then there's sheltered care. Sheltered cares, again, are similar to assisted livings. They provide personal care, supervision, oversight, and an activity. They will also have activity programs, as the other entities do as well. And what happens here is there's periodic medical supervision will occur with the people who live there. Sheltered care facilities only accept people that are over the age of 65. While others will admit some individuals that are of any age if they have a mental illness diagnosis. One of the things that does have to happen there is every year you need to be reevaluated to make sure that you still do need those sheltered care services. So that's one of the caveats to that program. Then speaking about mental health, we also have in Illinois entities called Specialized Mental Health Rehab Facilities. These provide rehabilitation, triage, as well as crisis stabilization to inpatient hospitalization, and stabilization for those who are in a post-crisis stabilization, and then also transitional living. They can select what entity they're going to focus in on. The purpose of a mental health rehab facility is really to prepare people with serious mental illness to reintegrate back into the community successfully. That should be their ultimate goal. It shouldn't be that this is long-term care. It should really be for those rehabilitative module or a model is what it should be. And there are about 20 of these in the state of Illinois. So they have people there that live there, or actually we refer to people that live in long-term care as residents. People who live there, we refer to as consumers. They're consumers there. So that's an entity for those that have mental health issues to be able to live in a rehab setting so that they can reintegrate back into the community. Then we have a community integrated living arrangements. You'll see a link on here as well, which that link will provide you with a provider listing of all the different community integrated living arrangements in the state. These typically are referred to as CILAs. Whoops. They're referred to as CILAs. These community integrated living arrangements are for people that are age 18 and older, and it can can also be referred to as a group home. It could be also a family home, an apartment, and that would be where 8 or fewer unrelated adults with developmental disabilities live under the supervision of a community developmental service agency. So they're smaller than the other entities that I talked about for those people that have a developmental disability. Residents receive complete and individualized residential rehabilitation or habilitation, personal support services, and supports under the direction of that community support team within a local entity that serves them. And then last, but definitely not least, is the medically complex for the developmentally disabled. We refer to these as MCDDs. Again, you'll see here that there is a listing website for those people that might be interested in more information on that. There are about 10 of these in the state of Illinois. And these are for people that have a developmental disability that have highly complex medical, very complex medically. And what happens is people that live there, they get their personal care and nursing care taken care of for individuals of any age. So there'll be a multitude of different people, age brackets that can live in there. Ombudsmen do advocate for people that live in MCDD, but we can only advocate for those who are over the age of 65 that live in these types of homes. And then I do want to just make note to the fact that there are independent living facilities. These are not licensed by the state, nor are they licensed federally. So there's no regulations for independent living facilities at the state or the federal level. So what does this mean? This has become very complicated for people, particularly during the pandemic, because there was no entity to be able to really hold the people who ran, who owned and ran these entities, these independent living facilities, to hold them to any regulations. We as ombudsmen are now allowed to advocate for people that live in independent living facilities, but we do get phone calls many times about this, and particularly at the state level. So one of the things that we always try to do is try to make a referral off to either tell people contact your the health department in the local community if it's something that's a health related issue. Building inspectors. I had an issue yesterday where somebody I received a phone call from somebody saying that they didn't feel that their building was ADA approved, that they didn't have, they weren't accessible for people with disabilities. So I referred them to go to building inspectors for the local community, to talk to their local legislators, to see who can come out and help advocate for those that live in those types of entities, the independent living facilities. Stephen,
Yeah.
did you comment?
Well, yeah, and to add to the confusion, about independent living facilities, a lot of them will have on-site nurses, on-site care staff who don't work for the facility, but they have an office there. And you, as a resident of that independent living facility, can privately contract with those care staff to provide you with services. So a lot of your assisted living facilities will actually include them when they're looking at their competition. So it's really important to understand that independent living facilities are not regulated, even if they have nurses on site. You might pay one bill, but it might be divided in 2 or 3 different ways, depending on what services you're contracting for and who you're contracting with. Any sort of nursing staff, you're going to be able to reach out to IDPH. Adult Protective Services also works in independent living facilities, but you may not be able to go after the independent living facility to file a complaint with IDPH. It would just be against whatever nurse that you're contracted with.
So that's very important information to know. And so many people enter living in a independent living facility, and they're not aware of all of these caveats. Julie, hi. Did you have a comment you wanted to make?
Well, I was just wondering if there was anybody that oversaw the home care that's in the independent living facilities. Like Stephen was talking about, there's agencies that are in them, but they're supposedly independent from the independent living facility, but they're like a preferred partner. And like I have a situation where a friend was in independent living, won't go into long details, but due to a hospital stay, she just needed some help. She was independent before that, but they're saying that for a live-in, because she can't get to the bathroom, and that's all. She's very mentally well and everything, but due to that, she cannot have a live-in caregiver because you have to have a second bedroom dedicated for for a live-in caregiver. And we thought that was rather crazy because this facility, this independent living facility, very few of them are 2-bedroom units. Almost everything is either a studio or a 1-bedroom. So that means nobody can have a live-in. So they are requiring her to have a by the hour caregiver for 24 hours. And it's now costing her about $25,000 a month in addition to her independent living cost. And so we had never heard of that rule about you have to have a dedicated separate private room for a live-in caregiver. And we were trying to find out where that is. And we have not been able to find it as a law. Now I can see if it's a policy, and I've checked with so many home care places, and they all said, yes, 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 it's a requirement. But nobody can point me to the law that says you have to do that. And people don't know that when they move into these places. And she can't get out because she can't walk. And I mean, it's a terrible, terrible mess.
Yeah. And that I don't know the laws for home care entities, but I can only think that that is a policy, but I don't know if it is a law or not. And I can
Right.
understand how if I was a living caregiver, I don't want to share a room with you if I'm going to be living there with you. So I could see how that could be potentially for the safety of the individual that's doing the care providing. I don't know. But it's just, I'm not sure who oversees
I
home
know.
care.
So if it's a policy, it would be a policy for the independent living's preferred provider, and she could go to other providers, but they just told her it's a law and she can't do anything about it. and she's very depressed because she's just sitting there all day long with this person sitting right there and
Yeah.
costing her, like $40 an hour. It's very, very expensive.
Yeah, the only thing I could think of is if she didn't live in an independent living facility and she moved into an apartment, that might be cheaper in the long run. And then she could hire that person to come in and to move out of the independent living facility, move into her own apartment. And then she may also start to be eligible for some other services through the state of Illinois as well.
Right. Well, I mean, she's not destitute. It's it's the details. I mean, like if you moved to an apartment, you'd have to worry about meals and stuff like that. So
And
it's
there
a
are
very
meals on wheels,
complicated
right.
situation. But I don't think they should allow that with assisted living. Because it seems to me that all these places are really just becoming very, very, very expensive assisted living facilities. Because the people, as you know, in most, very often, it's the mobility that goes first. And so they can't get around, they can't get any help. And so where do they go? I don't know. But thank you.
Yeah. Yeah. I wish there was something that we could do to help there, Julie.
Mhm.
But your experience, I know, because we've been in conversation, you and I, multiple different times. I think your experience speaks so much to that, not knowing about the independent living facilities, and with your, having your paths that you've gone down with that, with people that you loved,
Sure,
you
sure.
still care about. So I know that it's been a very eye-opening experience for you as you've navigated this.
Oh, sure. Well, my mother lived in a independent living facility, and I can think of 4 or 5 of her good friends that had live-in caregivers for a variety of reasons, and they didn't have 2-bedroom apartments,
Yeah.
and they were wonderful caregivers. She never got to that point, but, they were wonderful caregivers, and we all knew her friends and their caregiver. But all of
Yeah.
a sudden, this law popped up, and we can't find out anything about this law,
I'm going to do
and,
some exploring,
you
Julie,
know
and if I come up with anything, I will be contacting you, but I will be doing some
Thank you. Yeah,
exploring to
I
see.
realize this isn't your realm, so I didn't really wanna take too much time.
No, but the awareness is important for everybody that's on this call to be aware of these things, because we don't know what we don't know. And if we
Well,
can learn
right.
from each other's experience, that can be very, very helpful. So thank
Yeah,
you
thank you.
for sharing that. And, speaking about all of this, being that informed consumer, we wanted to make sure that we were sharing with you some resources here that could really help assist you with your care choices that you make. So there are these entities, and I am going to click on these, so I'm going to try to do it where I can, I'm sure you're not going to see my screen, so I'm going to try to do it where I can click on these fast, and then go over to the share again. Boy, I got a screen that popped up that will not let me get rid of it. Okay, here we go. So this is Care Compare. It's a federal site by Centers for Medicare and Medicaid Services. And you can see here, it lists the different entities that the federal government actually will help give some quality indicators for, so that as consumers, people can make some educated choices. So if you look here, they don't list out all the different entities. They just list out nursing homes. So if you click on that, and then you could put in the zip code, I'm just going to put in my zip code. And you do a search, then what happens is all the different entities, all the different nursing homes in the area come up. Now, remember, assisted livings will not come up because they're not federally regulated. So the federal government has no access to any data on them. So you can see, and then there is an overall rating that happens with each, but you can then take a look and you can actually see how that individual home compared. For the health inspections, the staffing, and their quality measures. And for each of these, you can click on it and you can gain a little bit more information about that particular home. Whenever I get asked that question from people, where should I go? I'm going into the hospital, get my knees replaced, and I want to go to a rehab facility afterwards. Lee, where should I go? I always point them to this site so that they can take a look at it. And I tell them to make sure they don't look at this overall rating like a hotel rating, a 3-star hotel rating, that they would look at it based upon the issues that are important to them. So like if you looked at the quality measures, what you'll see is you can see the different measures that exist. And then you can actually click on this. I know I'm passing through a lot of clicking, but you could see how well that home performed in regards to the nation and to the state of Illinois. And so if I was going there for short stay care, and this is for rehospitalization, after being nursing home admissions, and they tell me a lower percentage is best, this particular home is 32.7%. The national average is 23.2%. Illinois is 25.9%. This home is not performing as well as the average nursing home in Illinois or the state. So I might not want to go here if I was coming after a hospitalization to go to this home. And it can go through and you could take a look to see for each of these entities what's important for you. So I wanted to make sure that everybody saw this as well.
Yeah, it's really important to know, not to interrupt you, Lee, but it's really important to know that 3 stars is the average for the state. That's how the system is designed. If you've got 5 stars, that means you have very few tags. If you have 1 star, that means you have more tags, or the tags are more serious. And a tag, for those of you who don't know, a tag is a demerit that IDPH gives to facilities when they've done something that's not up to the standards that the state and the feds set.
Yep, very good. Thank you.
And Lee,
and-
it's 3:58, just so you
Oh,
know.
wow, that passed by really quickly.
Yeah.
Okay, so I'm going to stop that share. And then there's also 2 other resources. And let me just put my screen back up so I can get to that. We have the IDPH site, Your Way, and Elder Care Locator. All of these are going to be put into the chat. We can make sure that you get this. Many of these have been discussed during previous Resident Family Support Council meetings. There was one done completely on Care Compare, so look for that topic. Another one was done on looking at different resources when you were making your care choice, which included the Illinois Department of Public Health's site, and also included the Your Way information, which came from the Illinois Pioneer Coalition. And the Elder Care Locator is actually something that comes from the federal government that can help find entities in your state and your area for different services that you may need. And that can be an important thing to look at. Many times it will direct you to the Area Agency on Aging. If you don't know who your Area Agency on Aging is for you, you should really find that out and make connection with them so that you can find out the services that your Area Agency on Aging will provide for your area that you live in. Other things just to make sure that you consider is my biggest advice when you're making that care choice is to talk to as many people as you can and to go to the home. Go there a couple of times. This is really important. You are the one who is the customer. You need to be a smart shopper. You really need to make sure that you are making an educated choice and that you're paying attention to all of these things when you're making your care choices. Another word of advice, which we also did a session on this, is about the admission packet and what to expect when you are moving into a long-term care community. If this is something that's coming up on your agenda, make sure that you watch that YouTube video on that session that we did. Make sure that you look at everything in that admission packet and you really read it before you just sign it. And then lastly, look for Buddy. When you get into that home, look for Buddy. He's going to be your advocacy guide. And what we want you to look for is actually, I want to share my screen one more time because this is where we're going to have you vote. So don't leave me, people. Stay on. I want to make sure that we get everybody's vote for this. And I'm looking for it. Stephen, you don't have to have it, happen to have it up to you? Oh, there he is. I got it.
Okay.
Okay. I got it. So this is actually a project that Stephen has been working on. We have been working on trying to make our posters. It's a rule that every long-term care community has to hang these ombudsman posters up. These are 3 separate posters here, and I'm going to take you through each one. We are going to ask that you vote on it. I'm going to put the poll up. Whoops. I'm going to put the poll up as we are doing this so that you guys can start voting on this.
I don't know why the numbers didn't show up, or the letters didn't show up, but yeah, so
Yeah.
and to just kind of explain our the posters we have right here. The first poster is most like what we have currently. And Lee, if you go to slide 1, you can see it.
Yeah, I'm trying to get there. I got to move the poll out of the way, and because it went in advance for me.
Okay, push F5. That should.
You got it, right?
Yeah, this is slide. I don't know what, but this is the.
This is
Poster I
one.
was-
This is choice 1.
Yep, choice 1. So it's got an easier to read font than the current poster. It's been bolded to increase contrast. We added Buddy, and then we increased the space for the printed label. So there's more room for the ombudsman program information. If you go ahead and click that and go to slide 2 or option 2, this one's more minimalist. We wanted it to be really easy to read and share core ideas. We moved the logo down to the contact space. There's still enough room for ombudsman program contact information. We described the ombudsman as an advocate, so people can understand a little bit more what the ombudsman program is about. And then Lee, if you want to go ahead and click to the next one. This one provides a little bit more information. So option 3, a little bit more information. We have Buddy on there. And it's describing the ombudsman program. So if everyone could vote on their choice for this, we're trying to get some feedback on what people liked the best. And this will go into long-term care facilities throughout the state.
And I think if you vote, you can only vote once.
Yes.
And I don't know if people voted right away. So I'm going to actually relaunch this. I'm going to take this down for this one. And then I'm going to do it again because I don't know if people, I'm going to end the poll and then we're going to redo it to see if we get the same thing. Sorry. Oh, I don't think it will let me do it again.
Oh, that's all right. We've got the first time.
Yeah. Yeah. So here I'm sharing the results of the poll. We've got choice number 1 was 52%, choice 2 was 20%, and choice 3 was 28%. So there we go. Thank you.
Yep. Thank you.
We appreciate this, everybody. We're going to be reaching out to several different entities for assistance with this. Because we want to make sure that whatever it is that we do, it meets the needs for those people who need this. So thank you. Now, with all of that, does anybody have any questions? We went through a lot of information today. Does anybody have any questions? Were there any questions in the chat? And or if you have something else that's not even around this, what I'll go ahead is I will go ahead and I will stop the recording now. And I just want to thank everybody for being here today.